We want to go now to a panel of experts who represent the people on the front lines, America's doctors, hospitals, and nurses. Dr. Robert Waugh is the president of the American Medical Association. Richard Umbenstock is the president and CEO of the American Hospital Association. And in Minneapolis this morning, we're joined by Gene Ross, the co-president of National Nurses United. And Ms. Ross, I want to start with you. Your organization is the largest in the country, and last week you had some scathing criticism of the outrageous handling, as you called it, of Ebola at the Texas Health Presbyterian Hospital. They have apologized. They have admitted that mistakes were made. Do you accept that, and where do we go from here on this?
An apology is always nice, but a corporate CEO apology doesn't save lives. Where we go from here is to listen to us, which we have been begging for since the get-go. Once you've got the evidence that we were correct, that people are not prepared, nurses are not prepared, if we say we're not, we're not. It unfortunately has been borne out with the threats to the health and safety of the 2 RNs and possibly other workers. And so now is the time to listen. One thing we've done is to write a letter to President Obama asking that he set a uniform national standard that all hospitals must comply with in this system we have in this country. And we have a petition online at nationalnursesunited.org that we wish everybody would sign electronically to let him know that the public is solidly behind us in this.
Well, just to review for us, if you will, some of the things that you say went wrong at Texas Presbyterian, and what do you think needs to be done here?
Well, in this country, because of the system we don't have a national system. It's piecemeal, it's fragmented, and so each hospital is going to do, according to, I believe, CDC guidelines, what they want to do. Now, they choose normally in this country, the hospitals choose to like adapting to the equipment, et cetera, that they already have. And they are always looking at the bottom line. So what we want and need is similar to what you find at Emory in Nebraska. Nebraska has sort of become the gold standard for us. So that particular type of equipment, hazmat suit, respirator masks, and then the buddy system where we can watch each other don and doff, each one make sure the other's seams are taped, that kind of thing. And then allow our professional judgment, which tells you we should not be caring for more than 1 patient if we have an Ebola patient, and minimally perhaps 2 per patient, and then more if necessary. But you got to take into account that the nurses will tell you how much they can handle. So we've been asking for the proper equipment. We've been insisting on the staffing. That is what the petition is about. That is what we expect to save lives.
All right. Thank you so much. We're going to turn to Dr. Waugh and Mr. Umbenstock. Dr. Waugh, as a doctor, the nurse makes some very serious charges. Now, I must say that the hospital takes something of a different slant on some of the things she has said. Is she right?
Well, I think we all want to be as protected as possible in our work, and I think that's what she's expressing. And she's also expressing the need for preparation. And I think we are doing a great deal of preparation in this country. We've dealt with infectious diseases many, many times before. The AIDS epidemic, the other SARS epidemic that we had. So we know how to deal with contagious diseases, and I think we are responding in appropriate ways to do that. There are always opportunities to improve on that, but I think we have a great deal of experience in this country, and we are using that to prepare ourselves. I think right now is a time for preparation, not panic, and I think that we're doing that today.
Mr. Umbenstock.
Absolutely. Every hospital wants to protect its patients and its workers. There's just no question about that. We want to have the right equipment. We want to have the right protocols. We want to be practicing those protocols and improving them all the time, filling in where we find those gaps, as was mentioned earlier. Every opportunity to improve is really a nugget, and we've got to use it. But there's no question that there's no hospital in this country that wants to endanger any employees, and certainly not patients.
Well, do we have to have more stringent guidelines? We're told, you heard Dr. Fauci say he thinks, within the hour, maybe we'll get new guidelines from the CDC. The people at Texas Presbyterian said they did not breach any protocol, that they followed the protocols, and yet they still can't say how these nurses became infected.
As Dr. Fauci said, the protocols have been changing, and we have been then retraining to the new protocols. We're anxious for this next set of guidelines. We've been hoping to have them before this. We understand that CDC wants to vet them, make sure that they're absolutely right before they come out, but we're anxious to have them so that we know exactly the next level to which we're expected to perform.
Doctor, we weren't really prepared for this, were we? The CDC said we were, but I mean, as we found out, the first patient that shows up at a hospital, they send him home. Nobody would do something like that on purpose, but the hospitals weren't really prepared, and they didn't know what to expect, did they?
Well, I think that, as I said, I think we have a great body of experience with infectious diseases, and there obviously are, looking backwards, ways that we would have done things differently. I can't speak for the specifics at the Texas hospital. I wasn't there. I don't know the details of that. But there are, I think, in fact, good guidelines in place that have been vetted, have been reviewed by experts, and we believe are in place to help us diagnose who has the virus, make sure we isolate them appropriately and protect them, the workers and the other patients. And it is a dynamic situation. I think we have to recognize that. This isn't something that we can always anticipate every possible aspect of it. And because it's dynamic, we have to be dynamic in our response and our ability to talk to each other, learn from each other, and make sure we're
Do you too
changes.
have confidence in the Center for Disease Control now, the Centers for Disease Control?
Yes, we work very closely with them. We understand that they're operating in real time with this as well. They are the nation's expert. They're frankly the expert to which the world turns. But as Dr. Waugh says, you don't know what you don't know until you're into a battle like this. And then you have to react quickly. And that's what we're trying to do. We're trying to learn, share, and then act anew in a constant learning cycle.
Dr. Waugh?
I agree. I have every confidence in the CDC, but this is also a team effort. And we've reached out. We released a memo on just Friday of the American Medical Association, the American Hospital Association, and the American Nurses Association, because this is a team effort. It can't be done by one person or one entity, and we're all standing together to fight this battle.
Ms. Ross, do you have confidence in the CDC?
Yes and no, and I would beg to differ a little bit from what was just said. Yes, you cannot anticipate every possibility, but the nurses and other workers did anticipate what they needed before these errors occurred. We have been saying for months, we realize what it takes. We recognize, we work with Doctors with Borders. We know what is required. We know that the knowledge, the equipment was not being given to us. We have put up with this before. Unfortunately, in this country, we have a profit-driven healthcare system. And you cannot put a price on nurses and other healthcare workers' life. When it comes to the bottom line, that's what hospitals think about. So you have guidelines to follow. They knew what kind of equipment was required, even with the lesser protocols. Our hospitals did not have that. The nurses overwhelmingly told us this in the surveys. We are not ready. So some of this could have been anticipated and should have.
All right. Well, I want to thank all three of you for being with us this morning on this very serious and difficult topic. We'll be back in a minute to talk about the politics of Ebola.